Assalamualaikum and welcome to the step 5, giving information regarding the prescribed medication to patients. On average, about 50% of patients do not take prescribed medication correctly. They usually take them irregularly, or some of them may not take them at all. So the most common reasons are the symptoms has ceased. For example, it's quite common to occur with antibiotics, or if they have side effects that occurred, or they perceive that the drug is non-effective, or the dosage schedule is quite complicated for the patients, particularly the ones who are elderly. So non-adherence to treatment, some of them may not have serious consequences, but some of them may lead to a grave consequences. So patients' adherence to treatment can be improved if you give good enough information to them. It is your responsibility as a doctor to give information to the patient. Patients need information, instructions, and warnings to provide them with the knowledge to accept, follow the treatment, and to acquire the necessary skills to take the drugs. So in some studies, it has been shown that less than 60% of patients actually understand how to take the drugs that they had received. So information should be given in clear, common language, and it is helpful for you to ask the patient whether they can repeat the information in their own words. It's just a matter of getting them to understand what you said previously about the prescription. So there are 6 points that you should give as a minimum information about a prescribed medication to the patient. Number 1 would be the effects of the drug. Number 2 would be the side effects. Number 3 includes instructions. Number 4 is warnings. Number 5 is future consultation. And number 6 is you have to ask them whether they are clear with the information that you have given to them so far. So I will talk about each of these 6 points in the later slides. Let's talk about point number 1, which is the effects of the drug. So when you are going to talk to the patient about the effects of the drug, you would want to include the reason why the drug is needed, which symptoms will disappear, and sometimes some of them won't disappear, so you want to tell them which one will not disappear with the given treatment, when the effect is expected to start, and what will happen if the drug is not taken correctly or not taken at all. So point number 2 is equally important to be told to the patient, which is the side effects of the medication. You want to tell them which side effect may occur. So most likely you're going to talk about the most common side effects. How can the patient recognize them? How long will they last for, or how long will they continue? How serious they are, and what action should the patient take? So the third one is the instructions. So the instructions should include how the drug should be taken, when it should be taken. Is it in the morning, afternoon, nighttime? Is it before meal, after meal, or during meal? The third one would be how long the treatment should continue. It could be a week, it could be 2 months, it could be lifelong. How the drug should be stored. Is it in room temperature? Should it be in the fridge? And last but not least is what to do with leftover drugs. Should it be returned to the pharmacy? Should it be thrown into the dustbin? Now the fourth one would be warnings. So the warning should be about when the drug should not be taken. For example, drugs such as sulfonylureas should not be taken if the patient is not taking any meal, because that would lead them to hypoglycemia. You have to tell them what is the maximum dose, and you will need to tell them why the full treatment course should be taken. So this is especially true for antibiotics, and the reason why it should be taken into full is to prevent the emergence of resistance. So the fifth minimum information that you have to say to the patient would be about future consultations. In some patients, you don't need to see them back again at the clinic. Some of them, you want them to come back. So you have to tell them when to come back or whether they should not have to come back, and in what circumstances to come back earlier, what information the doctor will need at the next appointment. And last but not least, you need to ask the patient whether everything that has been told to them is clear. So you want to ask the patient whether everything is understood. You can ask the patient to repeat the most important information, and you also would like to ask the patient whether they have any information that they want to ask regarding the medication that you have just prescribed to them. Now the list may look like it's a never-ending list, and it may seem to be a long list that you have to go through for each patient, especially if you have had a long day or if it's a busy clinic day. Now, although the pharmacist or dispenser can also give this information, yet it is a primary responsibility for you as a doctor to be giving them the information, and this responsibility cannot be shifted to the pharmacist or the package insert. So be mindful of taking some of your time to give the necessary information regarding the medications to the patient.